This podcast is brought to you by NEMT Platform.
Today, we're diving deep into an industry that is truly a lifeline for millions. Non-emergency medical transportation, or NEMT. Think about it. A single missed dialysis appointment, or an elderly patient without a reliable ride to a crucial checkup. This isn't just about getting from point A to B.
No, not at all.
It's fundamental healthcare access, ensuring vital care isn't just a dream, but, well, a reality.
It absolutely is.
Yeah.
The reliability of NEMT services is directly linked to patient health outcomes and, frankly, overall healthcare costs for the system.
Right.
We're talking about a sector that serves over 3.6 million Americans annually. It's truly critical and I think often underestimated.
And our mission for this deep dive is to give you a shortcut to understanding this vital NEMT business. Whether you're an operator looking to grow, cut costs, or just refine your existing operations, we've pulled insights from a stack of expert articles and resources. Our goal is to make you truly well-informed on this complex yet absolutely essential sector. So let's unpack this.
Let's do it.
All right, let's start with the basics. What exactly is NEMT? It sounds straightforward, but I'm guessing there are nuances.
You're right to ask that. At its core, NEMT is specialized transport for individuals who need assistance getting to and from medical appointments, but without requiring emergency medical intervention during transit.
Okay.
The key distinction is that it's scheduled routine trips, not ambulance services responding to urgent emergencies. It's preventative, proactive care.
So it's about enabling consistent, ongoing care rather than just crisis response. That makes a lot of sense. And who exactly makes up this NEMT ecosystem? Who are the key players relying on these services?
Well, the patients themselves are incredibly diverse. You have elderly individuals who can no longer drive safely, people with disabilities needing wheelchair-accessible vehicles. We often call those WVs.
WVs.
Right. And patients undergoing regular, life-sustaining treatments like dialysis or chemotherapy. Then there are individuals recovering from surgery, and importantly, low-income families who might simply lack reliable transportation options. Their diverse needs are truly central to this entire system.
And on the other side, who relies on them to get those patients there?
Oh, everyone involved in healthcare delivery. Hospitals, dialysis centers, physical therapy clinics, specialist offices, they all rely heavily on NEMT to ensure their patients actually keep those crucial appointments.
Because a missed appointment is a big deal.
Exactly. It's not just a minor inconvenience, it's a breakdown in care. And then there's the insurance side. Medicaid and Medicare are often the primary payers. They recognize that transportation barriers can lead to more expensive emergency room visits and delayed, sometimes even life-threatening care down the line. It's really about preventive health.
Yeah.
And NEMT is a crucial piece of that puzzle.
It makes so much more sense when you lay it out like that, and this market isn't exactly shrinking, is it?
Far from it, actually. The NEMT market is experiencing significant growth. It's projected to reach $8.6 billion by 2026.
Wow.
With some forecasts pushing it even higher to maybe $12.8 billion by 2027.
That's huge.
It is. This growth is driven largely by an aging population and expanded Medicaid coverage. But here's the catch. This growth comes with skyrocketing operational costs and increasing regulatory complexity.
Oh, okay.
It's a booming market, but it's also a challenging one to navigate profitably.
That sounds like a double-edged sword. And what about the actual nerve center of these operations? I'm thinking about how these trips are actually set up and managed. What's the core of it?
That's where call handling comes in, and it's absolutely crucial. Many people might see it as just booking a trip, but NEMT call handlers go far beyond that. They coordinate with healthcare providers for precise appointment times and specific requirements, schedule transport based on patient mobility needs, their location, geography, and then manage vehicle assignments, considering driver qualifications and specialized equipment.
So much coordination.
It really is. This involves capturing detailed patient information, verifying insurance, and handling cancellations or rescheduling with immediate coordination across multiple systems. It's a remarkably complex dance.
Wow, that's a lot of plates to keep spinning. I can certainly imagine the communication challenges they face, especially with potentially vulnerable patients.
You're absolutely right. Patients often have communication barriers, hearing impairments, cognitive limitations, language differences, or even medication effects.
Right.
And these handlers are also dealing with protected health information, or PHI. So it's a careful balance of empathy, professionalism, efficiency, and strict compliance. It's a high-stakes conversation every single time.
And does effective call handling actually make a tangible difference beyond just smoother operations, I mean?
Oh, it makes a profound difference. Research shows that clear, empathetic communication makes patients something like 40% more likely to keep their appointments.
40%.
Yeah. Conversely, poor communication contributes to about 35% of missed NEMT appointments, often just due to miscommunication about pickup times or locations.
That's incredible.
So what seems like a basic administrative task is actually a critical pivot point for patient health and, business profitability.
That's a powerful point. So we've painted a clear picture of the NEMT landscape and its intricate challenges. But how do these vital businesses actually get their start? What does it take financially to get a piece of this action?
Now this is where it gets really interesting and often a bit daunting. Starting an NEMT business isn't cheap by any stretch.
I bet.
Initial startup costs typically range from, say, $100,000 to $500,000, depending heavily on your fleet size and the scope of services you plan to offer.
That's a wide range.
It is. Just one vehicle can run you $30,000 to $80,000. And remember, those wheelchair-accessible vehicles, the WAVs, they're significantly more expensive due to those specialized modifications they require. It's a substantial upfront investment.
Yeah, that's definitely a significant hurdle for many. So once you have an idea of those costs, what are the typical ways people find the funding for this kind of venture?
There are several common paths. Self-funding obviously gives you maximum control, but it can limit your initial scale if you don't have a huge war chest available.
Sure.
Traditional bank loans are common, especially commercial vehicle loans, where the vehicles themselves often serve as collateral. You can also look into SBA loans, though those can sometimes be a bit lengthy in their application process.
Right. Government processes can take time.
They can. And beyond the traditional avenues, are there other options worth exploring?
That's what I was wondering.
Equipment financing is a great option here because specialized lenders often understand the unique needs of the NEMT industry, particularly for vehicle acquisition. They get it.
Okay.
If you have strong growth potential and an experienced team, investor funding might be an option. But that does mean giving up some equity in your business, which you have to weigh.
True. Giving up control.
And it's always worth keeping an eye out for grant opportunities, especially if you're serving underserved populations. Sometimes there's specific funding available.
Good tip.
Finally, alternative funding like crowdfunding or peer-to-peer lending are emerging options that some are exploring. Still relatively new in this space, but growing.
Okay, so you've navigated securing the funding. Now comes the critical part, actually getting paid for these services. What's the reimbursement process like in NEMT? It sounds complicated.
Reimbursement is, well, the crucial aspect, and yes, it can be complicated. Medicaid is typically the primary revenue source for NEMT businesses.
Okay.
Understanding state-specific Medicaid reimbursement rates, billing procedures, and provider enrollment requirements is absolutely paramount. It varies state by state.
So it's not standardized nationally.
Not entirely, no. For instance, just to give you an idea of the detail involved in billing, effective July 1st, 2025, a specific code, HCPCS S0215, must be used for billing ambulatory or mobility vehicle mileage in certain areas.
HCPCS, what does that stand for again?
Good question. It's the Healthcare Common Procedure Coding System. Basically standardized codes for billing medical services and supplies. You have to use the right code or the claim gets rejected.
Got it. Very precise.
Very. And private insurance coverage varies widely too, so you'll need to research major insurers in your specific service area.
And what about these brokers I hear about, like Motive Care or MTM? How do they fit into the picture?
Yes, the broker ecosystem. Motive Care, MTM, Access to Care, Logisticare, these are major players. They act as intermediaries, typically for state Medicaid programs.
Intermediaries, how so?
They handle trip authorization, scheduling, and payment processing. Essentially, states often contract with these brokers to manage their non-emergency medical transportation needs.
So the state offloads the management to them.
Pretty much. Your success as an NEMT provider often depends heavily on integrating seamlessly with their platforms because they are effectively your gateway to a huge portion of the market. It's where a significant amount of your business will likely originate.
That makes a lot of sense. So you've got the funding, you understand how reimbursement works, at least in theory, and you're navigating the broker system. But simply having the money and understanding the rules isn't enough. Right.
Definitely not.
The industry is incredibly dynamic and operational costs are constantly on the rise. How do providers keep the lights on and stay profitable without constantly bleeding money?
That's truly the core challenge right now.
Yeah.
The profitability squeeze. Reimbursement rates are often stagnant, or at least not rising fast enough.
Right.
But operational costs are skyrocketing. Fuel prices, insurance premiums, stringent compliance demands, traditional fragmented systems, using spreadsheets and paper, they simply aren't cutting it anymore.
So where do you start?
The first step is identifying the biggest pain points, which often turn out to be surprisingly manual, things you might not even think about.
And what are those big pain points? Where do NEMT businesses typically lose money without even realizing it?
Manual processes are huge, hidden costs. Think about dispatchers spending hours, we're talking 35 hours a week for a small provider, just manually scheduling trips.
35 hours, just scheduling.
Yeah. Then there are paper-based trip logs requiring another 15 hours a week maybe for data entry, and manual billing. That can average 52 days for Medicaid reimbursement.
52 days. Wow.
Leading to errors, delays in cash flow, and missed revenue opportunities. It's just a constant drain on resources.
Oof, that's a lot of wasted time and money right there.
It truly is. Another major issue is disconnected systems. Using separate software for dispatch, billing, and vehicle maintenance creates these data silos.
Right, nothing talks to each other.
Exactly. It forces duplicate entry, makes comprehensive reporting a nightmare. And finally, escalating labor costs. Traditional models require larger administrative teams, and scaling means proportional increases in staff, which just isn't sustainable for long-term growth. You can't keep hiring people indefinitely.
And then there's the elephant in the room that everyone talks about, no-shows and cancellations. I hear those are a massive issue for NEMT specifically.
They're staggering, honestly. NEMT no-show rates hover between 15 and 30%.
15 to 30%, that's way higher than like a taxi service.
Way higher. The average in other transportation sectors is more like 5–8%. The why behind it is complex. Patients often have complex health conditions, mobility limitations, cognitive challenges, or socioeconomic barriers. Even medication side effects can play a role. But the impact is clear, and it's huge.
And the financial hit from those, it must be enormous just for one missed trip.
Each no-show costs between $45 and $85 per incident, depending on the trip.
Okay.
Let's put that in perspective. For a mid-sized provider doing, say, 1,000 trips a month with a 20% no-show rate.
Which is right in that range you mentioned.
Exactly.
Yeah.
That translates to monthly losses of $9,000 to $17,000.
Oh, per month.
Per month. Annually, you're looking at potentially up to $204,000 just gone from no-shows. And that doesn't even count the lost opportunity for other trips you could have scheduled in those slots.
Yeah.
It's an enormous drain that can absolutely cripple a business.
So given all these challenges, what's the path to efficiency here? How do NEMT businesses actually tackle these rising costs and, say, those staggering no-show rates?
It really all comes down to leveraging technology effectively. Smart scheduling tools, for instance, are revolutionary. They go way beyond simple booking.
How so?
They integrate with healthcare providers, communicate proactively with patients, sending reminders, updates, and optimize routes in real time. This alone can mean a 35–50% reduction in no-shows.
That's a game changer right there, honestly. Just cutting no-shows in half, potentially.
Absolutely. And then there's automated scheduling and dispatch, powered by intelligent algorithms. These can assign trips based on vehicle availability, driver qualifications, patient needs, real-time traffic conditions, geography, all the variables.
Takes the guesswork out.
And hours of manual work. We've seen cases where scheduling time for dispatchers was reduced from that 35 hours we mentioned down to just 12 hours per week.
Huge time savings.
And there's real-time GPS tracking and route optimization. This isn't just for fancy logistics companies. Live tracking helps dispatchers make informed decisions, dynamically optimize routes, react to delays, and significantly reduce fuel consumption. A 15–25% reduction is pretty typical.
So it's really about embracing digital solutions across the board then, not just picking one area.
Precisely. Digital trip verification and documentation means saying goodbye to cumbersome paper trails. Things like digital signatures, photo verification, automated logs, they streamline billing, reduce errors, and dramatically improve compliance, which is also huge.
Less audit stress too, I imagine.
Definitely. And automated billing and claims management systems. They generate accurate invoices and submit claims electronically, reducing processing time from hours to minutes and accelerating cash flow. Getting paid faster is a big one for small businesses.
What about handling all those calls, especially given the communication challenges we talked about earlier? Is there a tech solution for that too?
There is. AI-powered receptionists are becoming a really interesting tool here.
AI receptionists.
Yeah. Imagine a virtual receptionist available 24/7, handling maybe 80–90% of routine booking inquiries and frequently asked questions.
Okay.
This slash call center staffing needs by 60–80% potentially, and actually improve booking conversion rates by 25–40% because it's always available.
And the human staff can focus on the complex stuff.
Exactly. It frees up your human staff to handle the complex, empathetic calls that truly require a personal touch.
That's pretty incredible, frankly. And how do businesses actually know what's working and where they need to improve? All this tech generates data, right?
Absolutely. Data-driven decisions are key. Tracking key performance indicators or KPIs, things like on-time performance, cost per trip, client satisfaction, provides real-time visibility.
So you can see problems developing.
Exactly. It helps identify trends and potential problems before they escalate. It shifts you from reacting to fires to proactively managing the operation. And finally, don't forget, improved staff utilization. Cross-training employees and using dynamic assignments can boost driver productivity by 20–30%.
Meaning more trips per driver.
Meaning more trips with fewer drivers, or the ability to grow your business without proportionally growing your payroll. It's about working smarter.
So it sounds like these strategies are indispensable for survival, let alone growth. But you might be thinking, this all sounds great, but where do I even start to implement all this? That's where specialized technology comes in, I guess.
You're absolutely right. And that seamless integration with broker platforms we mentioned, it's no longer a luxury. It's an absolute necessity.
Why so critical?
Providers using broker-integrated software see a remarkable 40% faster claim processing, 65% fewer billing errors, and 30% higher contract retention rates. The numbers truly speak for themselves. You need a system that can speak directly to those major brokers efficiently.
So when an NEMT business is looking for good software, what are the absolute must-have features they should be prioritizing? What truly makes a difference?
Okay, number one, direct API integration. API, that's Application Programming Interface.
Right, how software talks to other software.
Exactly. It needs to communicate directly and securely with major brokers like MotiveCare and MTM for real-time trip imports and bidirectional data synchronization. Data needs to flow both ways automatically.
Okay, number one, API. What's next?
Second, Electronic Data Interchange, or EDI, compliance. EDI refers to the standardized electronic format for exchanging business documents. This is mandatory for most major brokers. It supports standard claim submissions, often called 837B files, and electronic remittance advice, the 835 files that tell you what got paid. It ensures seamless, error-free communication for billing.
So it's about making sure all the different systems can speak the same standardized language seamlessly, right? Without manual intervention.
Precisely. Third, look for advanced trip management features. Intelligent assignment based on driver location, vehicle type, patient needs, traffic, maybe even multimodal support if you offer different kinds of transport.
Smart dispatching, basically.
Yes. Fourth, comprehensive compliance and documentation. Automated tracking of driver licenses, certifications, vehicle inspections, APACTA-A compliance, and detailed audit trails. Makes audits much less painful.
I can imagine.
And for anyone running a business, a user-friendly interface is critical, especially for small to mid-sized providers. An intuitive design reduces training costs and error rates significantly.
Good point. What else should someone have on their checklist?
A robust mobile driver app is essential. Drivers need real-time updates, navigation help, and the ability to do digital documentation right there on the go.
Paperless in the field.
Exactly. You'll definitely want automated billing features, including multi-payer support and electronic claim submission, plus enhanced customer communication tools, automated reminders via phone, text, email, and maybe real-time ETA updates for the patients.
Keep everyone informed.
Right. Finally, consider scalable pricing and modular features, so the software can grow with your business without needing a complete system overhaul later. And, crucially, comprehensive support and training. That last one is huge for successful adoption. Don't underestimate the need for good support.
Okay, that's a solid checklist. Now, I've heard a lot about NEMT platform as a leader in this space, often setting the standard for these kinds of all-in-one solutions. How does it fit into all these needs we've been discussing?
Yeah, NEMT platform is a prime example of one of these comprehensive all-in-one solutions that really brings all these pieces together, aiming to streamline everything for a provider.
So how does it stack up against that checklist?
Well, it generally ticks a lot of those boxes. It boasts a modern, modular user interface designed for dispatchers, drivers, administrators. It includes features like a built-in AI receptionist for bookings and inquiries.
The AI tool you mentioned.
Yep. Automated trip scheduling with real-time optimization, live GPS tracking, and end-to-end Medicaid and private billing support. Plus, it offers mobile apps for drivers, a member scheduling portal, tools for building manifests, and smart trip matching algorithms. It's designed to be a comprehensive ecosystem.
Okay, so it's really covering all the bases you mentioned. What about that crucial broker integration piece? How does it handle that?
This is often highlighted as a strength, and it's something many providers look for specifically. NEMT platform offers native integrations with over 10 major brokers, including the big ones like MotiveCare, MTM, Access to Care, and Verita.
Native integrations, meaning built-in.
Exactly. Not just a workaround. This means real-time trip syncing, automatic status updates back to the broker, push-pull API compatibility, and electronic claim submission with built-in denial handling and pre-validation logic to try and catch errors before the claim goes out, reducing rejections.
Ah, that pre-validation sounds useful, less chasing down rejected claims.
That's the goal. It aims to make that complex broker interaction as smooth and automated as possible.
And for someone considering such a comprehensive platform, what does something like this typically cost? I imagine it's an investment, as you said.
It is an investment, but the idea is that the ROI makes it worthwhile.
Yeah.
NEMT platform, for example, uses transparent usage-based pricing. It typically starts at around $149 per month per vehicle.
Per vehicle, okay.
Yeah, plans are generally scalable based on the number of trips per day, the vehicle count, and the specific modules you choose to use, like maybe you add the AI receptionist or driver bonus features later.
You can tailor it.
Right.
Yeah.
And they usually mention no setup fees for standard plans, which is nice. It's typically backed by 247 support. It's really designed for those mid to large-sized NEMT providers who are looking for robust automated dispatch, those seamless broker integrations, and maybe AI-assisted operations with the flexibility to grow and customize.
That certainly sounds like it could make a huge difference in operations and profitability. Do we have any real-world examples of the kind of impact these integrated solutions like NEMT platform or similar ones have had on NEMT businesses?
We absolutely do. The case studies are pretty compelling. For instance, integrated platforms like this have been shown to save companies an average of 5-6 hours per day just by automating scheduling and billing.
5 to 6 hours a day.
Per day. Imagine what you could achieve with that much extra administrative time freed up.
Yeah, really.
We've seen smaller providers, starting with just a handful of vehicles, experience explosive revenue growth within months of adopting such technology. There's one story of a company starting with just 5 drivers, pulling in $27,000 in their first month using a system like this, then $65,000 in their second. Just 5 months later, they were consistently doing between $80,000 and $95,000 per month with only 12 drivers.
Wow, that's truly impressive growth for such a lean operation. That kind of efficiency gain is huge. Any other notable turnarounds?
Absolutely. We've seen examples of companies like, say, AeroCare Transport growing from 8 to 18 vehicles, increasing their trips by 150% with the same dispatch staff.
Same staff size. Amazing.
Improving their net profit margin by 46%, and significantly cutting down their Medicaid billing cycle to just 28 days on average.
Getting paid faster makes a big difference.
Huge difference. Another common outcome, like for a company called Valley Rise Transportation, the owner slashed administrative time from 45 hours down to 18 hours per week. That led directly to a 41% improvement in net profit margin and allowed fleet growth from 6 to 15 vehicles because they weren't bogged down in paperwork anymore.
It really transforms the operational core of these businesses, doesn't it?
It really does. Even entering competitive markets, like Metro Services did in an urban area, technology helped them increase monthly revenue by 173%, improve customer satisfaction to 96%, and hit 97% on-time performance.
The ROI must be incredibly compelling for these kinds of solutions then, looking at those numbers.
Most definitely. For mid-sized NEMT operations, the return on investment for implementing just the AI receptionist feature alone typically ranges from 150 to 300% within 18-24 months.
Just for the AI part.
Just for that.
Yeah.
And the total cost savings from a fully integrated all-in-one platform can be anywhere from 20-35% in the first year alone. For smaller providers, the payback period can be remarkably short, maybe as little as 6-12 months.
So it pays for itself pretty quickly.
In many cases, yes. It's
Right.
not just about spending money on software. It's about investing in a far more efficient, scalable, and ultimately profitable future.
That really does make a profound difference. Well, we've deep dived into the NEMT industry today, from understanding its critical role and the significant challenges it faces to exploring funding avenues, dissecting those crucial cost-cutting strategies, and finally, unveiling how powerful integrated software solutions are truly transforming operations across the board. It's clear that leveraging this kind of technology isn't just about efficiency anymore. It's about achieving sustainable growth and ultimately serving patients better in this really vital industry.
Indeed. The shift from manual, fragmented processes to integrated automated systems is proving to be the game changer for profitability and patient satisfaction. The smart money, you could say, is definitely on automation and integration.
So what does this all mean for you listening? Consider this. What could your NEMT operation achieve if you repurpose those countless hours currently spent on manual tasks and strategic growth, forging new partnerships, or perhaps even just enhancing the human connection that truly makes NEMT such a vital service? Something to think about.